some of the patients that were out there, I think one was Henry Dahlgren, I think. And I remember having to bathe them. Some of them had ribs missing.
Oh, sure.
And, you know, it wasn't a real fun place. And then we didn't wear masks.
Did you?
No.
No.
They didn't, weren't required.
Okay.
Otherwise, when I think of it now, we certainly should have had masks on.
Yes, right.
You know,
right.
We think about the COVID here, but that's nothing compared to tuberculosis.
That's right.
And then once you get the germ, I guess you never get rid of it.
What can you tell me about the Jordans, Kathy and Lou?
Well, now I only know his place is named after us, Dr. It's Jordan Drive.
Yes, Do you remember Kathy Jordan at all? His wife?
Well, yeah, she used to give them tests at school.
Yes, she did. So you were a CNA there at the sanatorium?
Yeah.
Okay.
I don't know if I had the title, but I was working there.
Sure.
You know, I can see beds lined up, maybe about a dozen beds laid up along, right side by side.
Mm-hmm.
They weren't divided or with a curtain or anything. They all laid there like that.
Sure.
All I remember is there were very sick people.
Okay.
But it seemed like Dr. Jordan was always a happy person, always smiling, talking to people. I remember I had the bedroom right above their bedroom.
Oh, you did?
Right above. And if I'd go out and get back in like about 8 o'clock, they would be in bed.
Oh.
We weren't allowed to stay out after 8 o'clock. And he said, "Eleanor, don't you wear 2 shoes when you go out?" He said, "I only hear one hit the floor." So I never forgot that. I was embarrassed, and I wasn't used to a doctor making a joke out of it.
So it was 1962 that I worked at the SAN, and I went in for the interview, and Dr. Jordan and Mrs. Jordan, Kathy, both asked maybe 2 questions. Okay, you're hired. That's you look like you can walk straight, that kind of thing. And it wasn't an intense interview, and I could start immediately. I'm not sure what my title was, whether it was nurse's aide, whether it was custodial, whether it was cook's helper, because I worked in all those different parts of the building. We only had 2 residents or patients at the time. They were getting ready to, soon to close down because there just weren't that many cases. So my job was in the morning was to go into these 2 residents, and I had no mask, but I had to wear gloves and a tin cup, and they had to sputum into the cup. And that had to be, then I had to cover it and label it, and that had to be returned so the doctors could check them, either Kathy or Dr. Lou. And that was my only connection with the residents and the patients. And then I would go to the central office where there was a receptionist / worker, and they would assign me other duties. We worked a 12-hour shift, but after your first 6 hours, you got a 2-hour break. So in this building, there were tunnels underneath the building. And those tunnels were for the employees and for the staff to get from one end of the building to the other. So when you finished your first 6-hour shift, you would go down into those tunnels. They had little rooms assigned to each worker. And there was cots in there with pillows and blankets and things. And you took a 2-hour rest. They didn't say you had to sleep, but you were to go to that room and there was a cot there. And after your 2-hour rest, then you would come upstairs and work your second 6-hour shift. I can't tell you what the rate of pay was at this time. And, 60 years ago, it probably wasn't all that much. But the joy of working with Dr. Jordan, with Kathy, was just visiting with her, listening to her talk. She had stories to tell of her childhood, not in the United States. She wasn't raised in the United States. And the stories she would tell of her childhood and growing up, and just whether you believe the story or not, which I'm sure was true, but it was just listening to the words, the accent, the language. It was, and she was so kind, it was so good. Lou would kind of gruffly say this or that or whatever, and she would just kind of smooth it over. It was okay, just let Doctor get. I worked there in the early spring or late winter, early spring, so the gardens and things weren't ready, but they did have a big garden space between the building and the river. They had beautiful flowers there, and I visited there other times. And vegetable, they raised all their own vegetables for their food for the staff and the residents or the patients there.
My name is Sharon Odegaard Olson, and I remember Dr. Kathy as a Sunday school teacher here. I also remember her beautiful voice. I always enjoyed listening to that. She was a very kind person, and I remember Dr. Jordan bringing us on tours of the Tuberculosis Sanatorium that she and her husband ran here in Granite Falls. At Christmas time, we were there to sing, the Sunday school was there to sing Christmas carols for those hospitalized there at the sanatorium. And in the summertime, we made a little tour outside. I remember they had a pond in the backyard with goldfish in it. So that was very interesting to see. I remember when she came to the schools, especially the girls, some of them would faint by just looking at the white jacket. And she was always very kind and explained to them and got them settled down before she did her test.
She did a lot of work with Christmas programs, and then of course, as she's very well known for, all of the shots, injections that she gave up at the school, testing for TB.
I just remember her being a very kind person and very gentle.
She was very kind to all the kids, and she really loved company at her house. I can remember her saying, if you have time, you can stop over at my house. And then, of course, the shots at the schoolhouse as well.
I do remember going out to the sanatorium for singing, and that was always a fun time to do that.
This is Mary Kelling talking to Florence Olson, who worked at the sanatorium years ago. So when did you work at the San? Do you remember what years?
Yes, I started there in 1948. I worked there till I got married in 1950. And then after a few years, I went back to work again, and I worked there for a while my two boys were in school.
What was it like working at the San back then?
It was nice because Dr. Jordan and Dr. Lewis Jordan were just like parents to me. They really took care of me. They were real good to me, and it was fun. I had a small apartment downstairs, and most of the girls were there, and it was fun. I worked in the dining room. I took care of the dining room during meals.
Oh, good.
After I got down there about 6 months, I think, 6-7 months. And then when I could go home, he said, "You come back and you work here." My mother was living in Odessa, Minnesota at that time. And they took me back up there, and they gave me a little apartment, and I worked in the dining room. I took care of the patients that could come to eat down in the dining room. I took care of them first, and then I took care of the staff when they came.
Well, tell me about your dad, Florence.
Well, I was I was about 17, I think, and he got sick, and he ended up at Walker, at Agwaching, up at Walker, Minnesota, where the big sanatorium was. I had to go in and have x-rays and mantle tests. and I was the only one that was positive out of all of us that was there.
Okay.
So I had x-rays, and they saw lung spots on my lungs, so they said, you have to go there. So then I ended up with my dad there about 3 years, I think.
Did you?
Oh, yes. I think it was almost 5 years in all the time that I spent in bed.
Really? So when you were in Aqua Ching, when you went and you had to be treated for TB.
Well, I just had bed rest. That's all they believed in up there.
Well, that's all they had. Yeah, that's all they had at first was bed rest, good food, and fresh air.
Yes, we had a lot of fresh air.
Yeah,
Afternoon naps, and the windows were all open, and the evening in bed, the windows were all open, and you snuck down underneath your covers in the wintertime, and that's some of the treatments we had. I shouldn't have brought this up, I suppose. But
No,
this is exactly what we want to hear about.
This is exactly what we want to hear. So, boy, do we appreciate talking to you.
Okay, thank you.